Pardon me. It's on the debate.
Yes. Proceed.
Thank you, Mr. Speaker. It's an honour and a privilege to rise and speak to Bill 24, the Health Quality Council of Alberta Act. I believe the title should go a little bit further, though, to explain what's the health. I believe this is nothing more than an act that's been put together for the health and the quality of the PC party and their new premier. It has very little to do with the Health Quality Council judicial inquiry that should be being brought forward. And again, it looks like an extension of a cover-up to me. I just want to start off with, I guess, by mentioning that it was back in March of this past spring when the former premier called for a Health Quality Council, and at that point there was a lot of debate saying that that wasn't going to do the job. The Health Quality Council was to look at the quality of delivery of health care in the province, and I think that we can say that the delivery is actually pretty good. The wait times, the concerns are another issue. But what was at issue in the root of this entire problem is the intimidation and the, again, as Mr. Duckett spoke out later after being released, the priorities and the influence that government MLAs were having on the health procedures being performed here in the province. And so there's two or three things that I think that is unequivocal when it comes to asking Albertans on the street, and that is that the intimidation is real. That there's been economic intimidation in the province. There's been intimidation in many areas, in many departments. But the one that concerns Albertans the most is the intimidation that's gone on to doctors and healthcare professionals who are trying to provide service and be advocates for Albertans, and been told that, you know, don't step out of line. Things could get iffy for you if they do. And it's very, very disappointing that we are not having a full judicial inquiry. We already have an act here in the province for judicial inquiries, and there's nobody, I don't think, over there in the government side that knows and understands that better than the Premier. And there's no question that back in June and July, before the first report came out, that the Premier, talking to reporters, very much indicated the need for a judge and the need for a public inquiry, and wanted to restore the confidence of Albertans in the, I want to say, the governance of the quality of health that's being administered here in this province. And this Act is not going to address any of those concerns for Albertans. And it's a confidence crisis that is ongoing. We have lost healthcare professionals who have left the province because they've been told that, you know, if you want to stay here and speak out, your future is jeopardized. There's been times access to operating rooms and other areas that have been brought forward. But I think what's the tipping point for all of this was just 2 days ago, where our health critic from Calgary Fish Creek has been in contact with many physicians who have said over and over again, and even the Alberta Medical Association says that physicians will not come forward unless it's a full judicial public inquiry. And even with the Medical Association speaking out, this government has put their Q-tips in their ears and plugged them so they don't have to hear it. The past health minister spoke out unequivocally on the 4th of October, saying that he would not support a health care inquiry into the health care, and he said it would be a waste of time and money. But I think what it's all about is the health of the government, that it's jeopardizing their health if there was a full inquiry to be going forward. And I think our new Premier even was so naive at this point to think that she's new in here, I'm clean from this, and so I can talk about a public inquiry. But to me, there's no question that the information that's coming forward is so damning that they're saying, you know what, we can't have an open and public inquiry. We have to remain behind closed doors. And this bill, Mr. Speaker, addresses that. It gives all kinds of protection where they can say that I guess, kangaroo court is going to say, well, this is damaging. We will do this in camera. And it's written in this bill to protect them. It's protection in here for third party. And I have to ask, who is this third party? I think they're sitting over there on many spots on those benches that are the third party that it's referring to for third party protection in here. This is very alarming and just concerning that this is the first step that this Premier wants to take in fixing the crisis in our health care. It needs to be addressed. Bill 24 simply does not address it. It's interesting, you know, why not make it mandatory to have a judge to do the investigation on here? I mean, they talk about it. You would think that it would at least be so simplistic when they're writing this to say, well, we won't leave it up to the minister or cabinet. We'll actually make it legislation and say that it must be a judge. But they don't even do that. They leave it vacant to say, well, at our discretion. And everything that I look and read and hear about this is for the protection and the health of the government. And that's disappointing. What we're worried about is the health and I want to say the health of and the morale of our healthcare professionals. It's never been at a lower time for those that I speak that have been practicing health for 40 years in the province. And they say that the frontline morale of those professionals providing this service is at an all-time low. They've never seen it worse. And this goes back again. And originally, when the new super board was put together, it was mandated there. They were not to speak out, and they would be punished if they were. And then they says, oh, we'll recant that. But the punishment continued. And it's just ridiculous to think that, oh, because they recant it, it's not going to happen when it continues to happen. And colleagues see this, and there's a few individuals that say, you know what, I'm not going to be part of this. And they've moved on. They've left the country. These are world-class healthcare doctors and professionals that don't want to be here anymore, and they don't have to be. They want to be. And again, in the case of Dr. Malioko, all I can say is thank you for someone who's willing to speak out, but this government has no desire to have a full inquiry. And I believe personally one of the reasons why he spoke out is because of the amount of time and testimony that he provided to top healthcare professionals, and those on the Health Quality Council, and to the, Dr. Chris Eagle, and to all of those, and to Ken Hughes, the chair of the Super Board. And when they came out with their midterm report in October, which I might also add, Mr. Speaker, is when this was supposed to come to a conclusion, he wasn't even mentioned, not even mentioned in that report. I find that astounding that he spent over 2 hours and talked about it, had the email to say, look, they told me that you would regret this if you speak out. And so he says, well, I guess I'll look after myself. I'll find another job. He's also said, Mr. Speaker, that he feels in his new jurisdiction where he's at, and they've recruited him, they're excited to have him, to put his team together. It's going to take him 2 years, he thinks, to duplicate the team that we have currently at the Tom Baker facility on lab tests. We all know when it comes to sports that when you have a winning team, you can't just dismantle it and move it and bring it back together. They've spent years putting this together, and yet there's no regard. And in 8 more days, that facility is going to be shut down and moved, and says, oh, there's no harm, there's no danger. But what's critical in all of this is that this government has already called on the Health Quality Council to do an inquiry. It's failed, it's clear. So now they're looking at having new powers to reinstate and to call new people for a kangaroo court to look at this. And they've gone to great lengths, again, as I say in here, to protect the government, to protect health ministers, to protect super board members, to protect everyone except for the doctors, the nurses, the healthcare professionals, and the people of Alberta. And you just have to ask why. Why are we doing this? And then it comes quite crystal clear. Why? Because there's an election. We have a flexible time period. And I think the number one reason for that flexibility is well, in case there's an economic downturn, not a climate downturn, or there's a healthcare downturn, not the season, a dry season, or a scandal. Thank you, the member from Edmonton Gold Bar, that Oh, so many, so many. What kind of scandals? The honourable member from Edmonton Gold Bar is asking. Be better to ask them. They know where, as the terminology is, the skeletons are in the closet. But, Mr. Speaker, it's incredibly concerning that this government and this new Premier has come forward with a bill to say that we're going to give new powers and create a new Health Quality Council of Alberta Act to get to the root of this. I don't see any intention or desire on this government to do that. What they want to do is postpone it. This is like finding out that you've got a wisdom tooth that needs to come out. And when you think about that, you go, holy smokes, I got to postpone. This is going to be painful. And as you go forward, I talked to one individual that the doctors for years tried to tell him, need to take out your wisdom tooth, causing him migraine, headache, and everything else. And now, because he's delayed so long, he's been told that it could give permanent damage and he won't have sensation in his tongue. And so now he puts up with the headache because he doesn't want to lose his taste. And I think this is exactly the problem here, is that they've postponed it. They had a year to have the Health Quality Council investigate and to bring forward and account for the intimidation and the bullying that's going on, and they've failed. And because of that, and it's real, they can't have an inquiry now, because if they were to pull out that truth, it would cost them their life. And so this is about protecting their very life, going into an election with no evidence being brought forward like you would under a health or under a judicial inquiry, a public judicial inquiry. And it's just extremely disappointing. We need to do better. This bill should not be supported. This government should not pass this bill. They should do what the Premier promised, and that is to bring forward a full judicial inquiry and to actually bring forward witnesses that are able to speak, that are truly protected, and not just pushed out of the province and said, go practice somewhere else, we don't need you. And a flippant remark by our new health minister that, oh, no problem, we can just transfer these people over. There's nothing to worry about. We can carry on with this testing and put a new team together and have that world-class experience transferred over when we don't even know how many are going to leave on that team. Is the government even aware of how many of those pathologists and those working over there are leaving because they're so upset with the way their colleagues have been treated? As Albertans are continuing to lose confidence in their quality of health care, and the health care professionals are the ones that have been asking the most for a full judicial inquiry. And it's disappointing, to say the least. A few other points that maybe we can go over. Public interest. How many times do we hear the Premier use the word public interest? I don't believe that the PC party's interest is in alignment with the public interest. If it was, they would be doing something different. They're about power, they're about control. We see they continue to want to centralize those powers, those decisions, and they don't want to turn it over to a public inquiry. I very much believe, because of the damning evidence that would come forward and would be detrimental to the health of that party, even the life of that party. And, Mr. Speaker, I just can't express enough my disappointment in the Premier and her solution that she feels is for the people of Alberta, when everyone that I talk to that delivers health care, those that are citizens that are concerned about this, they just shrug their shoulders. They're in disbelief. What are they doing? Why are they delaying this? Why can she pop out and spend $107 million in days, but yet she can't call a full judicial inquiry in those days when, as I said earlier, I don't think there's anybody over there who understood it better than herself, and the quotes that she gave to the media for those months leading up to her leadership, what a full judicial inquiry was. And yet she misled the media, she misled the members of this House, she misled Albertans, and is disappointing. And the member from Calgary Egmont is shaking his head.
Order. Yes, sir.
To the honourable members, clear and intentional breach of the rules with respect to using unparliamentary language. I heard the word misled and mislead probably 10 times. I didn't quite start the count, so I'm not sure exactly the number of times.
No respect
and
for the
mislead is not a parliamentary word. It doesn't show respect for the legislature.
Actually, it has been used more times than necessary, and in the context is everything, and I do believe that the honourable member also used the phrase deliberately misled, which is even more damaging. So, you've only got 22 seconds left. Can you sort of just clean it up?
I appreciate that, Mr. Speaker, and it does get frustrating, I guess, on this side because you hear it used so much. I forget that, I mean, it's just done. It's say one thing, do another then, I guess. But it's just misspoken, misunderstood. But the perception, when you look at what the reporters recorded versus what's happened, there's a dichotomy here that cannot be brought back together.
Honourable Member, Standing Order 29-2A is available.
I have a question for the honourable member from Calgary, Glenmore, and certainly I enjoyed his remarks on Bill 24, the Health Quality Council of Alberta, and I have a question for you regarding the regulations. And the Cabinet may make regulations. They have 16 ways here to write a regulation, as I see it, and I'm curious if you thought if they would table those regulations and you had a chance to look at them, would your opinion on the bill change? And is it possible that if you saw the regulations, you may consider supporting it? Because there's 16 different ways here to write a regulation. Thank you.
The honourable member, if you wish.
Thank you. That's an excellent question, and I guess that I would say I think if they were actually to bring forward the regulations, it would be more damaging rather than more supportive. I mean, what's the famous quote? The devil's in the details. The details are missing. The details are left to the whims of Cabinet, and I'm very concerned that the inquiry would be regulated to death and controlled to the point of strangulation and not function properly with those regulations that are coming out. I mean, what should be is it should be simple and clear, a full judicial inquiry, and then the Inquiry Act would take place and a judge would step forward. It would have the rules of court. They'd be compelling evidence. They'd be compelling witnesses, and they would actually probably get to the root of this. But none of that I have seen in here is going to be in there other than the smoke and mirrors that they speak about that they could. They might be able to, if they desire to. All of the wording in there is such that you have to ask, it's so ambiguous that, oh my goodness, look at the latitude that they're giving this. There's no desire to come to a solution, and if they had a desire to come to a solution, it would have come out already. And again, in October, when they came with their report, and I think this is the most disheartening for healthcare professionals, was the fact that many of them had gone in and testified already and spoken to the Health Quality Council, and there was very little, if any, mention of the bullying and the intimidation, which is real and is happening, and we're losing professionals from the province. And so are they going to come forward? Are they going to compel witnesses? No. I think they've got a list of who not to call, probably. That would be in the regulations to say, well, you know, don't call this or this area. We don't want to get into that. And again, it's about protecting the government. It's about protecting past ministers. It's about protecting the Super Board. And it's just wrong. I mean, Dr. Duckett has spoken out and has made mention. And I think he did that with a lot of thought and carefully worded on the manipulation and how his hands were handcuffed and unable to perform the way he wanted to, and was completely frustrated. I mean, that day where he put a cookie in his mouth, I believe was because he was told, don't you speak or talk to any reporters. And so what did he do? He thought, oh, that would be cute. I guess I'll just chew on a cookie to avoid that. I mean, Dr. Duckett was an individual, and we could have used him for another year to go through with his experience to find out what is the problem on the efficiencies in our hospital. What is the true cost of each operation in Edmonton, in Calgary, in Lethbridge, and get down to the actual pennies and dimes on what the problem is and the efficiencies, but yet he was not used for the talents that he had, and it was very disappointing. But this Quality Council will not I don't believe they'll even bring him in to ask him anymore. And again, the biggest problem is that they have the discretion to go into camera where they think that there might be third-party harm. Third party for who? Let's have the names on who they're worried. The last 3 health ministers, the last 2 premiers, who are they needing to protect is the question that one has to ask. But I thank the honourable member for the questions, and I think those regulations will be more prohibitive to finding the truth than helping it.